Did you know that how you touch yourself after 60 isn't just about pleasure, but a crucial tool for your prostate health, urinary control, and emotional well-being? It's a topic society prefers to keep quiet about, but science and real life compel us to discuss it maturely. Many older men, out of shame, lack of knowledge, or simply because they cling to old habits, are making a series of subtle, almost invisible mistakes that, far from giving them vitality, are silently harming their pelvic health, sleep quality, and emotional connection. Today, we're going to break that wall of silence. I'm Dr. Elena Castillo, and my experience treating thousands of patients in their golden years has taught me a fundamental truth. Male sexuality and self-care are vital topics that deserve respect, honest information, and zero taboos. I'm here as your ally, not to judge, but to illuminate the path toward a better quality of life. Understanding and correcting these habits will not only bring back pleasure, but will also protect the health you value so much, because fulfillment doesn't retire. Understanding and correcting these habits will not only bring back pleasure, but will also protect the health you value so much, because fulfillment doesn't retire. To begin, we must address mistake number 1, the most insidious and frequently adopted in the pursuit of privacy and speed: masturbating while sitting on the toilet or in any body position that restricts pelvic space. At first glance, this seems like the most practical option. It offers privacy and a comfortable, readily available surface. However, its convenience is inversely proportional to the potential damage it inflicts on one of the most sensitive areas of the male body, the prostate and pelvic floor. When you sit on the toilet, your body's natural posture isn't optimized for relaxation or blood flow, but for defecation. Your body weight, combined with the tension we instinctively apply to focus or hold it in, falls directly on the perineum, the area just below your genitals. Think of this area as the foundation of your pelvic strength. By sitting rigidly, you're exerting constant, focused pressure that acts like a gentle but harmful tourniquet. This compression significantly restricts arterial blood flow to the pelvic region. Poor blood flow, gentlemen, not only makes it difficult to maintain a firm erection, but it also interferes with the body's ability to drain lymphatic fluid and excess blood after activity, which can lead to a feeling of bloating or dull discomfort. Even more serious, this position directly compresses the prostate gland. The prostate is designed to be flexible and well vascularized. When it's under mechanical pressure, it suffers a kind of chronic stress. This pressure can not only exacerbate pre-existing inflammation, prostatitis, but also excessively strain the pelvic floor muscles. The pelvic floor is crucial. It's the muscular hammock that supports the bladder and controls urination and ejaculation. If you keep it tense and compressed during climax, these muscles learn to hypercontract. What are the subtle signs that this habit is taking its toll? Many men describe persistent dribbling after urination, which isn't entirely related to BPH, benign prostatic hyperplasia, but rather to pelvic sphincter fatigue. Others report unexplained perineal pain, or a tired legs sensation in the pelvis after ejaculation. These symptoms are often a direct result of nerve compression and muscle strain induced by restrictive postures. The pelvic nerves, especially the pudendal nerve, are incredibly fragile and essential for urinary sensation and function. When these nerves are repeatedly compressed, they can send erratic signals, contributing to urinary urgency or that dull ache that keeps you up at night. Correcting this error is fundamental and surprisingly liberating. The key is decompression. The goal is to release your pelvis and prostate from any pressure. My first recommendation is to stand whenever possible. When standing, gravity works in your favor, allowing for optimal blood flow and maximum relaxation of the pelvic floor. If you prefer to sit, choose a firm chair, reclining slightly so your hips are elevated and your perineum is free from direct contact, or better yet, lie down. Lying on your side or back, using a pillow to support your lower back, allows the pelvic muscles to fully relax and the circulatory system to work without restriction. Remember, pleasure and self-care should feel fluid and unconstricted, an experience that nourishes, not strains. Decompression, by releasing the nerves and allowing blood to flow, is the first essential step. But if the pelvic floor is the hidden engine of your well-being, controlling the power of orgasm, the firmness of erections, and continence, it's not enough to just let it rest. You need to learn how to turn it on and off properly. Many men confess to me, Dr. Castillo, I know where my biceps are, but where is my pelvic floor, and how do I feel it? It's a group of deep muscles that act like a hammock of support, running from the pubic bone to the coccyx. It's not easy to isolate because when we try to activate it without guidance, the natural reaction is to engage large, external muscles like the glutes, the thigh adductors, or the abdominal muscles. The most common mistake, and one that aggravates prostate and sexual dysfunction, is not just inactivity, but incorrect hyperactivity or chronic tension. When I ask them to activate their pelvic floor, many clench tightly, attempting maximum power Kegels, which results in excessive tension of the anal sphincter and a blockage of circulation, increasing internal pressure on the prostate and further compressing the pudendal nerves. The key is subtlety, the awakening of deep body awareness. I want you to focus on one concept: internal lifting, not external tightening. To locate this muscle group correctly, I suggest 2 visualizations while lying down or sitting with lumbar support. First, try the imaginary urination interruption. Notice the sensation in the area between your anus and testicles, the perineum. That's the core of the movement. Now, forget about clenching your buttocks muscles. Instead, imagine your perineum as a lift. When you engage it, you don't squeeze it tightly, but gently lift it, as if you were sucking a marble inward, toward your navel, without tensing your shoulders or face. Aim for a contraction that doesn't exceed 20% of your maximum effort. It should be a subtle movement that no one else will notice. This activation must be integrated, vitally, with your breathing. The pelvic floor and diaphragm are intimately connected. Think of the diaphragm as the roof of your abdominal cavity, and the pelvic floor as the base. They work in tandem. When you inhale deeply, diaphragmatic breathing, your belly expands and your pelvic floor descends slightly, preparing for the exercise. When you exhale, the diaphragm rises and the pelvic floor gently lifts. Effective and safe strengthening occurs on the exhalation in that natural upward movement. If you hold your breath or tense your chest while attempting the exercise, you are increasing abdominal pressure, negating the benefit, and promoting the kind of muscle hypertonia that is so detrimental to nerve and circulatory function. I recall the case of a patient, let's call him Miguel, who suffered from painful ejaculation. He had been performing Kegels so aggressively for years, thinking that more intensity meant better performance, that he had developed chronically contracted pelvic floor muscles, pelvic hypertonia. His engine was stuck at full speed. I asked him to let go of the idea of strength and focus for several weeks only on relaxation when inhaling and only 10% contraction when exhaling. The moment his muscles learned to relax, the burning sensation disappeared, and the quality of his orgasms improved remarkably. The pelvic floor is like an orchestra. It needs to learn the complete melody, relaxation, rest, so that it can play the loud note, activation, when needed during sex, urination, or exertion. Success lies not in the raw power of contraction, but in the refined control of relaxation and activation. By mastering this subtlety, you are restoring the prostate's natural support, allowing for full blood flow, and most importantly, awakening a sensitivity you may have thought lost. By mastering this subtlety, you are restoring the prostate's natural support, allowing for full blood flow, and most importantly, awakening a sensitivity you may have thought was lost. This is where we must address the third fundamental error, one that, if not corrected, negates much of the physical work we have done. Apressar a experiencia, or treating auto-touch as a performance task. Modern man, often conditioned by a culture of immediacy and stress, approaches intimacy with himself or his partner as a race against time, where the goal is the rapid release of tension and climax. When self-touch becomes a simple release of pressure, a quick action to get that out of the way, we are sending a very clear message to our nervous system. This is an emergency. There is no time for safety or full enjoyment. This rush comes at a profound biological and neurological cost. The body isn't a steam engine that reaches peak performance at the flick of a switch. To experience the fullness of pleasure, we need to activate the parasympathetic nervous system, the rest and digest mode, which is the ideal environment for releasing the full hormonal cascade. I'm referring to oxytocin, the bonding and calming hormone, and dopamine, which provides that sustained, deep reward, not the fleeting adrenaline rush. If the experience is rushed, the body remains in a state of slight sympathetic tension, fight or flight. An orgasm may be achieved, yes, but it's a chemically incomplete orgasm. It's like trying to pick fruit before it's ripe. The hormonal reward is partial. The nervous system quickly learns to associate pleasure with superficiality and tension, rather than deep connection and relaxation. Over time, this pattern of rushing teaches the body to lose sensitivity. If we only seek maximum friction and speed to achieve the goal, we are deliberately ignoring the entire range of subtle sensations. The warmth of the skin, changes in breathing, the response of deep tissues to gentle touch. The brain, being efficient, begins to filter out these subtle signals because they are not relevant to the goal of finishing quickly. It is a form of self-imposed desensitization, and it is one of the main reasons why many men report needing increasingly intense stimuli, or even very specific visual material, just to feel something. I remember Jaime, a successful executive who complained that sex had become boring and that he could only get aroused by extreme fantasies. In reality, his fantasies weren't the problem. The problem was that his nervous system had been conditioned to ignore any stimulus that wasn't high intensity and short-lived. We had taught the body to overlook 90% of the sensory map. We need to redefine the purpose of the experience. It's not about performance, it's about presence. I ask that, over the next few weeks, you shift your focus from goal to exploration. Treat self-touch as a sensory mapping practice. The goal of this new approach, slowness therapy, is to restore the connection between subtle pleasure and the response of your reward system. This begins with a simple rule. The first half of the practice is strictly for exploration and slowing down, with no intention of reaching climax. It is an exercise in curiosity and patience. What does this look like in practice? Think of the prostate and perineum not as a switch, but as a thermostat. We want to raise the temperature very slowly. Start with the breathing we've already discussed, making sure your pelvic floor is relaxed. Now, use a gentle, light, almost superficial touch. How does your skin feel when you're barely touching it? Where is it warm? Where is it cold? Many people are surprised to discover that the deepest and richest sensitivity doesn't necessarily reside in areas of intense friction, but rather at the edges, in the transition points. I propose a technique, the 10% rule. Intentionally limit stimulation to a maximum of 10% of the intensity you would normally use. Maintain that low level for at least 10 minutes. Use this time to notice your body's responses, your heartbeat, the pulse in your fingertips, the temperature of your breath. By doing so, you are inviting oxytocin into play, and you are reprogramming your system to understand that safe and profound pleasure requires time, presence, and subtlety. The body begins to trust. This slow therapy isn't just a stimulation technique. It's a diagnostic tool for your frequency pattern. If you're someone whose frequency is too high, 3 or more times a week, often due to routine or stress, slowness is your antidote. The problem with excessive frequency is rarely the quantity of ejaculations, but rather the quality of the stimulation that precedes them. When pleasure is sought quickly, through intense friction or high-speed pornography, the body becomes accustomed to an immediate hormonal surge. This irritates the prostate and pelvic floor because it subjects them to peaks of tension followed by collapses, depleting vital energy. The practice becomes a low-performing habit that requires repetition to maintain a sense of satisfaction, but never fully achieves it. By limiting the intensity to 10% and stretching the practice to 10 or 15 minutes, you are teaching your body a new lesson. True pleasure is lasting, subtle, and doesn't need to be frenetic. At first, this may feel frustrating for someone accustomed to speed. That's normal. The dopaminergic system, addicted to highs, will protest. But by persisting in subtlety, a profound transformation occurs. The experience becomes so nourishing and complete that the need to repeat the act the next day or two simply disappears. Quality replaces quantity. You shift from operating out of need to operating out of conscious desire. In my years of practice, I have seen how an intentional reduction in intensity leads to a natural decrease in frequency, returning to the equilibrium point of 1 to 2 times per week, with a feeling of fullness and conservation of energy. On the other hand, for those who fall into the opposite extreme, very low frequency, driven by guilt, shame, or disinterest, slow therapy offers a less intimidating path back. Prolonged abstinence creates stagnation. Tissues need circulation, the prostate needs healthy blood flow, and desire is, to a large extent, a function that thrives on attention. When the practice is perceived as a chore or a performance demand, the obligation to finish, or the expectation of achieving stratospheric pleasure, it's easy to avoid it altogether. However, if you redefine the act as a simple exercise in breathing and circulation, applying only that 10% of subtle touch without the intention of reaching ejaculation, the pressure disappears. It's no longer a search for climax, but a meditation on intimacy. It's a way of saying to your body, I'm only here to give you circulation and pay attention to you, without any expectations. This kind of contact, devoid of pressure to perform, is what allows repressed desire, perhaps frozen for years by guilt or disinterest, to begin to thaw. Think of the gardener analogy. If you overwater and water too vigorously, high frequency, the roots rot. If you stop watering altogether, low frequency, the plant withers. The ideal is subtle, consistent, and measured watering, allowing the soil to remain moist and nourished, but never saturated. The prostate is our inner garden, and it requires this same balanced care. This is the essence of why the ideal range of 1 to 2 times per week, based on the feeling of balance after practice, works for most men. It provides sufficient flow without causing exhaustion. And I want to be clear, exhaustion isn't just physical. Ejaculation that occurs through rapid tension or pleasure without presence, 90% of the usual intensity, is profoundly catabolic. It drains. The release that occurs after slow, mindful practice, where oxytocin has had time to take effect and the body has remained relaxed, is much more anabolic. It energizes and nourishes. It's not the quantity of fluid that matters, but the energetic charge with which the act is performed. We've come a long way today, demonstrating that the optimal frequency of 1 to 2 times per week transcends statistics and becomes an act of balance and profound nourishment. The key, as we've seen, lies in transforming ejaculation from a catabolic habit to an anabolic release, where quality, presence, and a slow rhythm govern the practice and allow desire to thaw. Now, I want to hear from you. What is the most profound change you've noticed in your energy and well-being by applying awareness and balance to your intimate practice? Your experiences are the heart of this community. If this conversation has brought you clarity, please subscribe to the channel to continue exploring male potential, turn on notifications so you don't miss our next analysis, and share this video to spread this vital knowledge. I am infinitely grateful for your time and trust. Until next time, take care of your energy and live fully. I am Dr. Elena Castillo.